Thank you so much for joining us. I'm Aisha Tolliver here. We're doing a special episode talking about this horrible, horrible flu that has taken over the world, it feels like. They are saying the highest rates in 25 years. So we really want to talk all things this seasonal spike, what we're seeing, how hospitals are dealing with it, how they're trying to prevent the spread. And of course, there's no one better to do that than Tracy Odachowski with Centera Health. She's the System Director for Infection Prevention and Control. Tracy, thanks for joining us.
Thanks for having me.
Excited to talk about this because it's the hot topic. There's really nothing else that people are talking about in grocery stores, at barbershops, everything. Yes. I think everyone knows someone that's been sick at least within the past 2 weeks.
It has definitely taken over, yes.
So let's start with a little bit about your background. Let's talk about what you do and kind of your responsibilities within Centera Health for the infection prevention and control.
Sure. I am the System Director for Infection Prevention and Control. So we have infection preventionists at all of our hospitals, our medical group, all throughout the system across Virginia and Northeastern North Carolina. And then we also have a manager and myself. So we manage all of the things infection prevention related every day, both looking at if we have infections, what things can we learn from them, and trying to really prevent them from the get-go. Manage any of the spikes like this and flu and a host of other things that we do even beyond just the typical patient-related items. So we're kind of in it all day, every day.
Oh, such a time. So one of the things I recently had COVID, and when I went, I did a virtual appointment for through telehealth. Fabulous. But they were like, you need to go, and there's a double test now for the flu and COVID. So how hard is it right now, I guess, for people to differentiate between the two?
It is a little tough. They've got a lot of the same symptoms, anything respiratory related. So that includes RSV as well. Those are usually the big three. And those respiratory symptoms are really similar in the fever. And it kind of depends how severe you get it. And if you have any other comorbidities, you might get it more severe. So it's really tough. And the best way to differentiate is the test. There are home tests now that do have both COVID and flu, so that makes it a lot easier. We, of course, have respiratory panel tests that we can do within our doctor's offices, urgent care, ED. Virtual care, we really want to, especially if you just have mild symptoms, virtual care is probably the best thing you can do. So congratulations for doing that. Because really, who wants to go anywhere when you feel sick anyway?
Not me. Not me. And it's fast. It's so fast. I mean, typically I will say when I knew things were bad, because normally you go, first available appointment, and it'll take maybe 10 minutes to get a call. It took an hour and a half for me to get a call. And they were saying unusual. They were backed up. Yes. So I said, ooh.
Still better than the emergency room though.
Yeah, exactly. So I'm like, if that's the virtual side of things, I can't even imagine what these hospitals are looking like right now. So I guess take me back to the beginning. When did you guys start to see that this was going to be a bit bigger of an issue than a regular flu season?
Yeah, we started seeing it probably around early to mid-December is when the increase started. And we very quickly saw more and more positive tests. We get a weekly report, which usually throughout the rest of the year, I have 1 or 2 patients on every week. When you start getting into multiple pages of it, you know that it's started. So we saw that early December. And we really tried to push everybody get your vaccine before we got to the holidays, because once you get the holidays, everybody's around each other and it's going to increase quickly, and it did. Mm-hmm. So Christmas week was when the spike really came up. I mean, in 1 week, the state of Virginia went from low flu activity to high, and I can't say I've seen that in my last 5 years of working this job ever. There's usually at least some moderate weeks in between there, and there was nothing. There just went straight
boom,
to high.
0 to 100.
Yeah.
And now it's even more, right? We're in the very high category here in Virginia,
yes,
correct?
We are. It did come down ever so slightly this past week for the data that ended January 3rd. Yeah, don't get too excited. That happened last year too. So most of the time with flu, if you look back at all the data, there's one spike hump. But last year we actually had two. So it went up, it went down a little bit right about the same time of the year. And then by the 1st of February, it spiked even higher. It looks like it might do that exact same thing again this year. We're predicting to have the highest levels by the first week of February.
Mhm.
So we'll see how it goes, but we at least get a little reprieve right now.
Whew, okay. So strap in there, folks, because
Yeah.
we're not done yet. We are not done yet. And it's kind of shifted in who it's targeting, too, right? Because it was kind of like teenagers, and now we're seeing smaller children with it.
Yeah, when I looked at the data earlier today, the heaviest hit so far by far is actually over 65 years old.
Mm.
And then the next highest age group is 0 to 4. Then you get into the 5 to 17, and then the rest of the adults are a little bit lower, just depending if they have comorbidities. But the very young and the very old are typically the ones that get the heaviest hit, and that's what we're seeing.
So when it comes to who should show up at the doctor's office or who should just stay home and, get the fluids and take some, Tylenol or whatever, how are you guys advising people to move?
So anything with mild symptoms, you want to try to stay out of the emergency rooms. You can use virtual care, see if your doctor has a walk-in clinic. And that's basically if you can be managed with any home options like Tylenol for your symptoms. You still want to call and hopefully get on Tamiflu if it's available so that it doesn't get any worse. But you probably could very easily manage it with either one of those visit options. You start getting into urgent care if it's making you really weak, if you're having a little bit of trouble breathing, or you just feel like you need a little extra care. You want the emergency room if there's any shortness of breath, feeling lightheaded because of a decrease in oxygen, starting to get anything more severe in your symptoms, or if you have a lot of comorbidities where it can become very severe very quickly. I mean, I've seen my experience before this is in intensive care, and I've seen during bad flu seasons that someone can go from walking and talking to in an intensive care on a ventilator and 5 drips and laying on their head trying to get blood to them within 5 hours.
Mm.
So if you are a high risk category, you want to be seen. You need to make sure that you're keeping in touch with your physician and make sure that you're treating it as quickly as possible to not make it get that bad. But if it starts getting that bad, head straight to the emergency room. That's when we want to see you in the emergency room.
Yeah. So I've had some coworkers who has turned into bronchitis and even
Mm-hmm.
pneumonia.
Mm-hmm.
Is that a trend that you're seeing as well?
Yes, that's the most frequent trend that we'll see for anyone who is admitted with it. So you definitely want that. Again, that's the appropriate time to get to an emergency room because you don't want that to get any worse and have to get a hospitalization.
What's the best way so for people who are going to work with some mild symptoms, how do
Mhm.
you decide, okay, like I can still move around with this, but you're also contagious and can give it to someone who
Yeah.
could have worse symptoms, right? So how do you
Yeah.
advise people to kind of move in that aspect?
Don't.
Don't
Stay
do it.
home. If you now I get sometimes the nice part is you can get meds delivered and things like that nowadays, and so you really don't need to go out, but you should not go to work even if with mild symptoms, don't do it. That's just putting everybody else at risk, and you don't want to be the person who got your family member or your coworker sick. And what if they are one of those that are in the higher categories and higher risk, and then they end up getting the hospital? Is that really what you want to be responsible for? And you gave it to them, and then now they're in the hospital with it. So yeah, the best thing if you have these symptoms, stay home. A lot of jobs can allow you to work virtual, so see if that's an option. If not, just get the rest you need.
Hmm.
You'll recover quicker that way too. Stay home, get your rest, go back out when you're feeling better. And
What?
then you wear a mask. If you have to go out, you have to go to the pharmacy to go get your meds, you have to do something, wear the mask, wash your hands.
Yeah, it was kind of a weird thing because when I got COVID and I had to like go to the grocery store and things, I was
Mhm.
like, I had hundreds of masks a couple of years ago, and now
Right.
I got to go back out and get more
Where'd they
masks.
go?
Right. Where are they when I need them again? But it's interesting kind of how that whole COVID period really transformed our comfortability with masks. And now we can use them in a, touch and go kind of as we need
Mhm.
way, which we're seeing
Yeah.
hospitals do now, right? Can you talk a little bit about
Yes.
that?
Yes. I always recommend having a little supply of them. You can, as long as they don't get wet, you can wear them for a long period of time. It never hurts. You can certainly, again, back to we're 2 days where people deliver stuff to our houses. So
Hmm.
get a delivery really quick if you need to have them available and you don't have them. And we had the fabric masks too. They're not the better than having an actual procedural mask, or surgical mask is usually what they're called.
Hmm.
But it's better than nothing.
Right.
And fabric masks will work. It's just fine.
So when people are now going to visit loved ones in the hospitals, what are they advising? So I know this is a new policy that just came out, but it's affecting not just Centera hospitals, other hospitals as well. About how if you're having even the slightest bit of symptoms and you have to go to a hospital, mask up.
Yes. So some can't prevent going. If a patient needs to go and be seen, of course they're going to be coming in with symptoms. So we're asking all of those to mask up as soon as they're entering the hospital so that we don't spread that to others. Visitors, the same, although I'm going to go back to, if you're experiencing these symptoms and you're visiting, you probably should stay home and not visit. You don't want to make the person you're visiting sicker than what they are. But sometimes you can't help having to go. So if you are going with any of those respiratory symptoms, you need to mask up.
And as far as, because then I think people don't think about the repercussions, right? Because then your nurses get sick, your doctors get
Yes.
sick, and all of a
Yes. And then
sudden,
we have less people taking care of everyone.
right.
So yeah, we're experiencing all of that too, because healthcare workers get sick as well. And the tricky part with the flu vaccine is it does not prevent the flu. It minimizes symptoms if you get the flu. So even those who had the vaccine may still be getting sick with the flu and having to stay home too. So we're trying to prevent all of that spread to the patients, to our staff members, to other visitors, and making sure that everyone's masking up appropriately.
All right, we're going to take a quick little break and we'll be right back. We're going to talk about that flu shot because there's a lot of rumor going around about that.
Oh, yes.
All right, thanks so much for staying with us as we talk about all things flu here with Tracy Odachowski, the System Director for Infection Prevention and Control with Centera Health. And Tracy, we were just talking about the flu shot, right? Because especially right now with different advisements going on about these shots actually work? 30% of, the strains are prevented and then the rest are out there. Can you talk about and just clarify why people should get the shot or not get the shot and what the how it's going to help if you do?
Right. So this year's flu shot includes 3 different strains. So it will help prevent you from getting the 3 strains that are included. But then, yes, there's all these other ones, including the predominant strain that's out there this year. What about that? So what the flu shot does do is help you minimize symptoms even if you get one of those other strains. So it's most important for those high risk groups because you might still get sick, but you can do what we were talking about earlier of being able to stay at home, not having to go to the hospital, not being admitted, not being life threatening, hopefully. So it really minimizes that life threatening risk of flu. And I think that's probably the hard part with flu is most of us out there have probably had flu at some point in our lives, and you get stuck in bed for a couple of days. You get a few days off of work. It doesn't feel great, but you're okay.
Right.
And so, no, there's a lot of times people don't think about flu as being deadly. And it is. I mean, we lose millions of people to the flu. And one of the biggest things that we track with the flu is pediatric deaths, which must be one of the most depressing
Mm-hmm.
stats that we track in anything. But that's kind of the key indicator of what kind of flu season it has been. And last year we had the highest number of flu pediatric deaths in any year we've ever had in the
Wow.
United States. And, I think it hits home a little different because we're losing children. Um, so anything to kind of prevent that and keep that number lower to prevent the deaths. It helps not just you when you get the flu shot, but it helps your neighbor too, because you're not giving it to them. There's a little concept called herd immunity
Mhm.
that the more people we have that have a vaccine, the more overall protection there is for the entire community.
Mhm.
So the more we get, the better it is.
And then, recently there was, a lessened amount of advised vaccines for children. So I think it went from like the 17 that was typically, recommended to now 11.
Mhm.
Would you say that a child should still get, their shot for the flu or anything like that? What's your advisement when it comes to this and that advisement?
Yeah, the influenza shot I think is a really important one because it gets so prevalent every time this time of year because children aren't the best at washing hands and preventing sneezing and coughing on each other. I mean, it's you can only teach a small child so much. They're all around each other every day between preschools and daycares and school in general. So it's harder to contain because they can't stay at home.
Hmm.
And then they tend to not always tell you they're symptomatic until they actually are really feeling it. So by then they've already spread it. So I think that's why it's always been so important with the kids because it's kind of your first line of defense when they don't have all the other defenses that adults can take.
And what we're seeing too, I think, is families are saying our whole house has the flu, right? Because of how easy it is to spread. You have one kid with it, they're getting better. Boom, the second
Yep.
kid pops up with it. Now
Yes.
mom and dad are sick. The whole family is a
Oh, yes.
mess. What's the best way to kind of manage it within your home, or is there even a way to do something like
There
that?
is. So some easy ways. So number one, if you know someone is sick and you're having to care for them, that's when you pull the mask out even at home. So most of the time they're probably going to be in bed. So they don't need to necessarily wear the mask. It's tough when you're the sick one wanting to wear the
Hmm.
mask. But if you're going into that room to then provide care for them, go ahead and put your mask on. Make sure you're washing your hands. Don't touch your face until you've washed your hands because you don't want to transmit it that way either. So taking the precautions while you're caring for someone with it can certainly help prevent you get it and giving it to others. If it's someone who can, again, it's not always the easiest in the children, although there's a little trick, but don't cough or sneeze into your hand, do it into your elbow.
Mm.
That because again, if you get it on your hands, then it's easier
Mm.
to spread with your hands as well. The trick with children to do that is we call them vampire coughs. So if you've ever watched a vampire and they've got their cape on and they
Oh.
their cape over like
That's
this.
cute. Yeah.
So make it fun for the kid. Oh, did you do your vampire cough
Hmm.
and do a little trick like that? And frankly, it ends up being fun for the adults too.
That's
So
cute. That's really
teaching
cute.
them fun ways to be able to prevent it is always a good way.
Yeah, that sounds like great advice, honestly. I think so many parents are not really thinking about ways to still make it kid friendly because it is such like
Mhm.
a top like, mom, I don't want to take this medicine. I don't want to do that. And I've even seen like on
Yeah.
on TikTok, like moms will put like cold medicine with like like a starburst. Like,
Oh
have
yeah.
you seen like the drops you put in water to make it have some flavor or
Yes.
whatever?
Yep.
Have you seen these tricks that parents are doing that like to
Oh
make the
yeah.
cold medicine taste better? I'm like, y'all are brilliant. Where was my mom
Right.
when I hated cold medicine? Not
All we
doing
had was,
these things.
if you got the antibiotic, you might get the bubblegum flavor, but
Yes.
now they've got all this other great stuff that they can do.
Uh-huh.
Yeah, make it fun. It's not, they feel awful anyway, so you might as well try to find a little way to put a smile on their face. And it just helps all around to prevent all of the spread.
And how long are you advising people stay home? Obviously, COVID and flu are a little bit different. When I went to get my doctor, they gave me a note for 3 days off of work.
Mhm.
But that also led into the weekend. So I was out for like 5 days.
Yeah.
What are you advising people, and is it different based on your age?
It's different based on severity. The biggest thing is being fever-free
Mm,
without the use of any fever-reducing medicines like Tylenol or ibuprofen. So you have to be fever-free for at least 24 hours. Symptoms are decreasing, etc. If it gets more severe, so if a patient is in the hospital with the flu, our advisement with CDC is a minimum of 7 days. So they could be fever-free for several days, but because it's now tough, it's severe enough you're in the hospital, it's actually a longer period of time that we keep them on isolation. So it depends on severity, but minimum fever-free. And then there's lots of great resources on cdc.gov. Sorry, I wanted to make sure I got that one right. There's a great influenza page on there with information on when it's okay to go back to work. But usually it's a couple of days, 3 to 5 days in general. But just look for the fever.
And if so, in some cases, if it's a really low grade fever, like if we're looking at like little over 99, is that
Not a fever.
not even a fever? Okay, I thought 99. Look, I don't look. This is why I'm
After
asking you the
stayed under a
questions.
blanket too long, yeah.
My heater was on. My heating pad was on a little bit too long.
Yep.
So, what is a considered exactly like a fever level that you should go to the emergency room though with something like the flu?
Oh, so again, especially in those vulnerable populations, if you're looking over, we always look at Celsius as 38. I believe that's 101.3 if it's Fahrenheit. So anything over 101, if you're starting to really creep up to 102, 103, definitely at the point that you should be seeking professional help. But lower grade fevers around 100 and stuff, you can stay at home.
So right now, if I were to walk into an emergency department in one of the Centera hospitals, is it complete and utter chaos? Are people heeding y'all's advice of, don't go if you absolutely don't have to, or kind of what's that vibe like right now for people who are contemplating
I hope it's
going?
not chaos, but it is busy. It's been very busy this week. I believe one of the stats earlier this week is we had about 160 patients waiting for inpatient beds, which essentially is another hospital. If you took all of the hospitals and combined them together,
Right.
that's how many patients were waiting at all of them. So it's up there.
Do you ever send people just to wait out in their cars instead of sitting in the? Okay.
Yeah, they will. And certainly they give patients that option too. If they're not as severe, they might want to wait in their car because it's just a lot of people and you don't know what everybody has. So it can be safer just to go out and wait in your car. And then they use so much technology we can do now. They'll send a message when they're ready to be seen.
And how long are you guys seeing people with some of those like leftover symptoms, the cough, a little bit of the big thing I've heard is like lightheadedness too. Just getting easily winded kind of and getting up and down.
If you have it a little more like moderate to severe symptoms, that can last for several weeks. Just trying to clear everything out and get it out of your chest. One of the tricks is that things drain. So we're always sitting upright. Everything drains to the bottom of our lungs. So if you're having trouble getting all of that out to be able to clear and feel better, then lay down. Put your bottom up in the air on a pillow, like a pillow under your hips, and let your lungs drain downward back towards your mouth. That helps you kind of cough it out. Yeah, little tricks of the trade.
Interesting.
Even better if someone can kind of beat on your back and loosen it up, get it all draining so that you can more easily cough it out. The humidity certainly helps that as well, keeping it wet and being able to make it easier. You want to thin out those fluids. They can be really thick secretions that get stuck in the lungs, so they're hard to get out.
So humidifier if you can.
Thin that
up. Is there anything else? We have about 60 seconds left. Is there anything that you really want to drive home with people who see this?
it's not too late to get your shot. Keep in mind it will take about 2 weeks to be fully effective, but please don't feel it's too late. Like we said, we're expecting that spike to probably come around the beginning of February. So it's the perfect time to get it and hopefully avoid some of those more severe symptoms. And then if you do start having the symptoms, then play it safe, keep everybody else safe, stay at home, wear your mask, wash your hands.
All right, Tracy, thank you.
Vampire coughs. That's going to be our lesson for the day.
I'm going to teach everybody in the newsroom about the vampire cough. Okay. Thank you so much, Tracy, for being so patient with us today, especially. But we'll be in touch. And again, everyone, thank you so much for tuning in. And we'll brace up for February, I suppose, and just hope that everyone does what they're supposed to do. Wash those hands. All right.
Yes.
Thanks for watching.
Thank you.